This is Dr. Marty Harris, chiropractor from Key Health here in Circular Quay. I would like to talk to you today about a problem that I see on a very regular basis, which is sciatica. Now, sciatica is pain that travels down, originating from our bottom muscles through here, and one particular muscle in particular is called the piriformis. So if you reach around the bottom of your buttocks and push in, you'll generally find some tightness there. So sciatica can come from a number of different causes. It can come from deterioration in the spine leading to arthritis, and in that case there's going to be what they call a pinched nerve that can result from that. You could also have tight muscles coming from just over exercising or sitting all day. Either way, you're going to be getting irritation to the nerves that travel from the spine down the leg. And you can get an aching sensation that can affect down into the foot and might also get some occasional numbness. The idea about sciatica is it will get better if you leave it alone. It will take a few weeks or maybe even a few months. You could take non-steroidal anti-inflammatories. You could even have cortisone. But my suggestion is that you try this simple exercise to give you immediate relief and then consult your chiropractor. So what I'm going to suggest you do is, if you follow me, is if you get say the problem's coming down the left-hand side of your leg, we're going to get our left leg turned out in this particular fashion, and we're going to rotate our hip forward. And what this does is it's going to take pressure off that sciatic nerve and give you some relief going down through the leg. The other thing that I'd like to demonstrate for you is a stretch that we can do at home if you can get to a chair, and that involves putting your leg up over your knee like this and allowing it to stretch and open up. And I'd like you just to remain upright. Now, if you have to slouch forward or lean back, it really means that there's tightness in those extensor muscles, and those extensor muscles will activate those muscles down in here in your buttocks. So if you gently push down, just holding it there, seeing how far you can hold that resistance for, and then let go. And do that maybe 2 or 3 times. Don't push, don't bounce, remain upright, maintain good posture. The other idea that you can also try is to stretch the muscles into the buttocks. And the way we do that is if we cross our legs over, like crossing our legs, holding our knees, and gently pulling around, maintaining quite upright posture. And you'll feel a stretch down through the buttocks. Now, if any time you get any pain while doing this, then consult your local chiropractor, and we'll be able to help you get immediate relief for sciatic pain.
Hi, this is Will. Will's an AFL player, and he complains of sciatica, which is what we're talking about today. Turn around for us, Will. So his problem generally stems from this muscle group in here, our piriformis. It travels down the leg and goes all the way down to the foot, and it can lead to that numbness we were mentioning earlier. So what would a chiropractor do? Well, chiropractic is a gentle way of taking pressure off the spine. Onto your back for me, please. So you may have heard chiropractors do various things. There's many different techniques that have been developed that have had a great deal of success in the management of musculoskeletal pain. The technique we're going to show you today is pelvic blocking. And what this does is restore the body's position back to a comfortable position that takes pressure off those nerves. So we use these particular blocks. We get you to bend your knee for me, Will. I'm going to pop it underneath that leg like so, and this one underneath here, like so. Now don't go doing this at home. Okay? This is not your home advice for the general population. You need to go to a chiropractor to know what they're doing in order to know where these blocks are placed. In this case, we're trying to balance the pelvis and make it quite level, and at the same time take pressure off that piriformis muscle, which is tightening up for Will. This has the effect of making the pelvis more stable and more comfortable to allow the muscles to relax and take that pressure off the lower back. So he gets that problem coming down that right leg. This also happens to be the leg that is a little bit shorter when we look at Will's leg. And the reason for that is the rotation in the pelvis. More about rotation in pelvis next time, which is a common phenomenon that people encounter. one thing that I'll leave you with is don't leave your wallet or your phone in your back pocket, because if you do that, you're going to be sitting on it, and effectively you're going to be rotating your pelvis even more, which will fire up those muscles, particularly that piriformis and glute muscle, and send those messages down the leg, which is not what Will wants. So we'll be back playing AFL very shortly. Thanks for watching. This is Marty Harris from Key Health here in Circular Quay.